Good day, I'm Sadini Gunasinghe from Group 25 and today I'm going to demonstrate skills of caring for a bariatric patient. So bariatric patients are patients who are normally overweight or morbidly obese. They have a higher BMI, therefore normal daily activities such as walking, standing are difficult for them. So you have to be concerned about this, sensitive and keep that in mind when dealing with this kind of patients. Discrimination is a huge problem with bariatric patients as normally they feel very ashamed or embarrassed when they are in the hospital as they share the frustrations of care that the healthcare provider also feels. So it's very important to make sure that these kind of people feel at ease as possible in the every moment. We must avoid assuming that bariatric patients are just a larger versions of normal adults. They come with many comorbidities most of the time, so it's important to keep that in mind when we are dealing with this kind of people. When caring for the bariatric patients, we must keep in mind to check them on their vital signs such as heart rate, respiratory rate, blood pressure and temperature to make sure their breathing and respiratory rates are normal. Give them oxygen if they are needed. Most bariatric patients require oxygen and make sure they get the proper nutrition as well. It's important to anticipate the medical patient's care needs in advance so that you can get the required materials that may not be regularly stored in your unit. This includes thick-sized cuffs for taking blood pressure and larger wheelchairs for bariatric patients. Also, it includes larger hospital gowns and other things that may support bathing the patient or cleaning them regularly. Most bariatric patients require specialized equipment and hospital furniture, so it's your responsibility to make sure these are available for the patients. So, this includes a bed that can fully support their weight and is safe for the patient. Bedside chairs that are in the bariatric patient's rooms should also be big enough to fit the patient as well as any other relatives that also may be large. Regular hospital gowns will not fit for the bariatric patients, so getting a hospital gown which fit for them is also very important. If you cannot find one, you can use two hospital gowns, like one gown from the front and other gown from the behind, which joins the first gown. Using this kind of procedure is very embarrassing for the patient, so this must be avoided at all cost. When transferring bariatric patients from place to place or from bed to wheelchair, we must take an extra help as these patients are very heavy. Nowadays, we have devices which includes hover mat which curve around the patient and making them feel very comfortable. These kind of devices help to lift bariatric patients and transfer them from one place to another very easily. Sleep care is also very important for bariatric patients as they have lots of extra skin and folds, so it's important to keep the skin dry after you clean it. In between the folds and everything, we must make sure that the skin is not weeping, which means it is over moist. Be very gentle with them as their skin may be all stretched and their skin is highly sensitive to moisture and pressure. Using a pressure cushion may also help them. Patients will be seated on their buttocks for extended period of time, so this cushion will help with this kind of pressure. Additionally, the devices such as the bariatric heels folds which eliminates the pressure placed from the heels when lying down and patients special losses from forming on those areas. Barely patient often sweat profusely, feel shortness of breath due to the weight of the chest. This can be prevented and improved by improving ventilation in the room by installing a fan. For elimination of the bariatric patients, they may usually be catheterized and indwelling catheter is better for these patients as the quantum catheter might be difficult to place in an obvious male patient. For a perineal care, side-lying positions are easier than the patient lying on the back due to the patient's refuse to invest us for help with normal daily life activities. However, they do need assistance for these because some patients are too large to even conduct activities for their own personal hygiene, so this may things that you must make sure in your mind when dealing with bariatric patients. You in your shift you must check multiple times in between their skin folds, cleaning them regularly. So these things are you must keep in mind, because your patient may be too embarrassed to come to you and ask for this thing.